Madisonville's Mallory Loyola gave birth Sunday. A couple of days later, she found herself locked up at the Monroe County Jail, charged with simple assault for illegally using drugs while pregnant.
Last week, 26-year-old Mallory Loyola became the first woman to be arrested and charged for breaking a new Tennessee law that criminalizes mothers for using drugs while pregnant. Local authorities say that Loyola admitted to smoking methamphetamine just a few days before giving birth, and both she and her newborn baby girl tested positive for the drug. The Tennessee law is the first of its kind in the nation, clearing the state legislature with bipartisan support. Republican State Senator Mike Bell explained why he voted against the measure, noting, "I represent a rural district and there's no treatment facility for these women here, and it would be a substantial drive for a woman caught in one of these situations to go to an approved treatment facility." Looking at the map of the state, there are several areas where this is going to be a problem. Joining me now, Dorothy Roberts, professor of Africana Studies and director of the Race, Science, and Society program at the University of Pennsylvania. Professor Roberts, I think a lot of people have a broadly shared intuition that it's a really bad idea to do drugs while you're pregnant. This Tennessee law seems a policy expression of that intuition. Why do you think it's bad policy?
Well, it's bad policy because there's no evidence that it actually protects children from maternal drug use. That's a health problem that should be treated as a health problem, not by punishing women. There's also lots of evidence that these prosecutions are racially biased. There have been hundreds of them in the United States, and the vast majority of women who are prosecuted are black women who use crack cocaine during pregnancy. And it also diverts attention away from the real reasons why children are vulnerable, from poverty, racial discrimination, the difficulties of raising children in poverty, and blames their mother's conduct instead of looking at the real roots of why children are in jeopardy in this country. There's research showing that,
that research, I want you to talk about that research in a second, but I wanted to bring it back to crack cocaine because you've written on this, you've published on this and followed it. Of course, there was this wave of legislation during the 1990s when there was a lot of worry about so-called crack babies. What did that legislation do, and what did we later find out from the research about the actual science of women that were ingesting crack cocaine while they were pregnant?
Exactly. So during the late 1980s into the 1990s, the major targets of this kind of prosecution were black women who used drugs during pregnancy, and they were prosecuted under criminal laws that already existed, like distribution of drugs to a minor, or child abuse, or even assault with a deadly weapon. And this was based on the myth of the crack baby, that for some reason crack cocaine, unlike other drugs, caused irreparable damage to children, even causing them to have social problems, to become welfare dependents and criminals, all total nonsense, totally unsupported by scientific evidence. And the most recent research that actually tracks these children shows that their outcomes are no worse than other poor children in their neighborhoods. And the real harm to children is poverty, lack of good nutrition, lack of good housing, and the other damages that can be caused by not having the resources that mothers need to raise their children.
The study you're alluding to, I think we reported on the program, was a longitudinal study that actually tracked kids born during this era, all in poor neighborhoods, some whose mothers had used crack cocaine, some whose hadn't. And the conclusion basically was that the biggest problem these kids have is being poor, that crack cocaine was essentially trivial when compared to that poverty.
Exactly. There was never evidence that crack cocaine use caused any particular harms to children or was worse for children than harms of poverty, or that the reason that doctors were seeing certain health problems in children was because of their mother's crack use. That was an excuse, as I said, to divert attention away from the real systemic problems we have in this country based on racism, poverty, gender discrimination against women, trying to control pregnant women's behavior, instead of looking at those problems, blaming mothers, especially poor black mothers, for the problems their children are facing.
Dorothy Roberts, thank you so much.